welcome to Probetus Podcast. I'm Savanah Simmers, your host, and this season we are going through Giving Hearts Day and working with some of our local nonprofits to showcase what they do and how you can help support them. So for this episode, I have Kellie with me.
Hello.
From Hospice of the Red River Valley.
Yeah. Thank you for having me. I'm excited to be here and visit a little bit about our mission.
Yeah, we're so excited to have you. And Giving Hearts Day, for those who don't know about it, it's one day a year. It's an annual event where charities in both North Dakota and Minnesota participate, and it's just a 24-hour giving event.
Yeah, it's a giving day, and it's just really showcasing the strength of our community and our region that we live in. And we're so excited to be part of it. DMF had started it, back in 2008, I believe. And we've been with it since 2009, and
wow.
So we love it at Hospice. It's a great fun day to celebrate everybody in the community.
It is, and the crew over at DMF brings such an energy to this day.
Too,
It is magnified. It's just so captivating and fun to be a part of.
Yeah, absolutely.
And so tell me a little bit about your role over at Hospice.
Yeah, so I'm the annual giving officer at Hospice. So my job is to really spread the word to regular, everyday people, the masses, on how you can help Hospice of the Red River Valley and help people who might need our kind of services.
Yeah, and just kind of rolling into it. For those who aren't familiar, maybe haven't used your services, whether that be a blessing or a curse type of thing, what do you all do over there? And
Sure.
Can you tell us a little bit about your services?
Yeah, so our mission is to provide comfort and hope through life's journey. And so Hospice services generally focus on the end of life. And it's our job to walk alongside with families and the patient that is going through that. We all kind of know it's inevitable that we're going to have to face that one day, and our job is to help you get through that in the most graceful, dignified way that you can. And so our staff of nurses, CNAs, social workers are all there to help folks navigate that end of life period.
And it's just, I think those who have used your services will probably can advocate that it's something that you can't really put a dollar value on, how much you do for the family and the support that you give, whether it be medical and kind of the emotional, spiritual type of side as far as the transition. Yeah,
we're so proud of the work that we're able to do. Our providers are really, they're miracle workers on earth.
Yeah.
So when you think about hospice, a lot of people don't want to deal with it. They don't want to accept that. And we've got social workers who are there to help walk with your family through the decision-making process. So even if you're questioning it, you can reach out and call and just get your questions answered. It doesn't mean you have to, sign up and agree. It just provides that information. I have a personal hospice story. My dad had a cancer journey, and the hospice people that we worked with really helped our family understand what was happening to him, and helped us understand how that was affecting our family as a whole. And that's really invaluable, I think, for people. We always say that you don't get a second chance at this last part of your journey, and so it's our job to help make that the best that you want it to be. And it's really about focusing on the patient and then seeing how they want it to go. We've had stories of people, we help with pain management and medical things like that for sure. Yeah. But it's, do you want to take your grandson fishing one more time? How can we make that happen for you physically? Can we help you get your pain under control so that can happen? And things of that nature, just so that you make memories in that last bit of time rather than focus on what might be to come.
And that's incredible. I don't have a ton of experience in this area, so for me it's always very educational, learning more and getting to visit with people like you. And if there is a time and is there kind of when they know that end of life, like whether it's terminal illness or is it a doctor?
Sure.
Do you have to get referrals? How does
all of the above, really.
Okay.
So hospice criteria is that you have a 6-month or less diagnosis. So you're going to be working with your care providers for that.
Yeah.
And you can be referred to us by your provider, or you can self-select to come to Hospice of the Red River Valley.
Okay.
We have an 800 number and a super informational website that people can go to. But the thing that we really like people to understand is that it's never too early to call.
Okay.
If you have questions, that's what we're there for. Our phones are actually answered by RNs and
Oh, wow.
nurses. And so they're going to be able to answer some of those technical things that you're dealing with,
Yeah.
and then be able to connect you with the right providers to do some of the assessments necessary to get qualified for hospice.
Very nice. Yeah. And just knowing that you have that resource and that phone number where you can just call.
Yep.
It sounds like you welcome the questions.
Absolutely. And then if you do opt for our services, one thing that kind of makes Hospice of the Red River Valley unique is that if you're having a problem in the middle of the night or something is an emergency, we have access to our staff 24/7. And that, 3 a.m., you don't,
Yeah.
you don't want to call the ambulance because you're on hospice.
Right.
But you need that support, or
Yes.
something's happening, you don't know what it is. You can call us and we will be able to walk you through that. So that is, again, invaluable for the family so that you feel better about what you're doing in your journey and that you're doing the right things.
Yeah. How reassuring and just comforting, and makes you to know that you have that line that you
Yep.
can reach someone, and there's always that support,
Yeah.
whether it's
Absolutely.
3 in the morning or 3 in the afternoon.
And one other unique thing about hospice is that our medical director is here local, and
Okay.
she's amazing, and has such a heart. And so, we've got our nurses can walk across the hall and talk to our doctor if that is what is needed, or whatever it might be. So.
And how big is your reach?
Sure, we actually cover a really big territory. One of our goals is to really get into the rural areas because
Okay.
So much of Minnesota and North Dakota are rural.
Yes.
So we have a coverage area that covers northwest Minnesota, so from Lake Baudette down to Fergus Falls, Detroit
Oh,
Lakes,
wow.
and over, and then we actually reach all the way over to Bismarck. And so,
Wow.
and then Canadian border on North Dakota side down to the South Dakota border as well. So it's like 50,000 square miles or something
Yes.
crazy, 53 counties, and we're really, really proud of that because
That's incredible.
without our services coming into those communities, they might not have any other options. And then people are going through a time of uncertainty in their life without any resources or
Yeah.
with limited resources. And so that's really a big part of our mission and what I fundraise for. It costs money to go out into the rural
Mhm.
areas. And so that's the part of what supporting Hospice of the Red River Valley does, helps us reach those rural people when they need us.
And like you said, rural is huge in
Yeah.
our
That's
area,
that's
in the
where
Red
we
River
are.
Valley. Yeah.
Yeah.
We have our major metros,
Yep.
but other than that, it's basically all rural.
Yeah, yep. So we're really proud of that. I mean, and the fun part of my job is I get to go out into some of these rural communities and visit
Yeah.
with people who have been affected by our services, and to hear their stories is so rewarding.
Yes, I can only imagine all the emotions that come with learning
Yeah.
those stories from
Yep.
firsthand. How many physical offices do you have across the state? Is there?
Yeah, we have 8 of them actually.
Wow.
Up to Thief River Falls.
Okay.
Detroit Lakes, Fergus, Fargo, Valley City, Devils Lake, and Bismarck.
Very nice.
Yeah, I think that's 8.
So you're close. If you do have
Yes.
questions, of course, there's a location. However, the phone
Yeah.
number is a great resource, and like you said, your website
Yeah.
is very captivating and can help navigate.
Yeah.
Very user friendly. I jumped on there and to
Yeah.
check out a couple things. But with Giving Hearts Day, you mentioned you guys have been doing it since 2009.
Yeah, that was the first time we got involved with it. I wasn't here at that time, but
Okay.
but I know we have a history of really using this day to kind of leverage the community and tell you more about what Hospice of the Red River Valley does, and show that again, hospice is kind of a scary word, but
Yes.
it doesn't have to be, and we really want people to know that we're here for them. So.
And before we started, you mentioned to me that there are additional services other than just maybe what someone like me might think of hospice as that
Yeah.
end of life care. You mentioned you have some other grief counseling.
Yeah. So part of our service array, and this applies to everybody in the community, if you need grief counseling or support, we provide that free of charge to everyone in the community. So
yeah.
that's a huge value that I'm not sure everybody knows.
I know.
Part of the hospice service, the technical hospice service, is 13 months of grief support for the
Wow.
family members afterwards, but we wanted to do more, and so we opened that up to the whole community. That can come in the form of support groups. We have classes, we have remembrance services, and then if needed, that individual one-on-one work with our social workers who are trained in grief and bereavement.
Excellent. So that is unique to just the Red River Valley.
Yep, unique to Hospice of the Red River Valley, absolutely. And
Very nice.
That's one of the, value adds that we really feel proud of that we can help the community with.
And when you're supporting that money staying local
Yep.
and it's going towards these type of services and your neighbors, your community members, all of those people who are using.
Yeah. Some of the other things that we do with our philanthropy, our fundraising dollars, we have a great volunteer core, people who volunteer for us. And that ranges from people who are literally sitting with folks as they're going through those last stages of life,
Okay.
To helping us with office and administrative work, to working on special projects. And so philanthropy dollars come in and help us support those special projects. One of them is our celebration bears, which are so, so cool. Family members of Hospice of the Red River Valley can provide us a shirt or two of their family member. And we have volunteers who will help turn them into 2 stuffed teddy bears per family. And
I love that.
so we need to offset the cost of those types of things, and that's part of what we're raising money for. The other thing, we have a huge chaplaincy program, and our chaplains reach everybody, no matter your faith or non-faith. They study, different belief systems, and they're really there to walk the spiritual path, because death and dying, that there's a spiritual component to that. It's not just a physical thing. And so that group of really amazing people is trained to help everybody through that, and that's another thing that our philanthropy dollars support.
Excellent. And you do have a goal this year.
We do.
What is that?
It's a big one. We are hoping to raise $750,000 on Giving Hearts Day.
Excellent.
A component of that I haven't mentioned yet is our hospice house project that we are building here in Fargo. It's called Heather's House, and it will be an 18-bed home-like facility where people who maybe can't be at home for various reasons, whether that's because their needs are too great, or whether that's a choice that they don't want to be in their home when they pass. Most people do, but we need an option like that here.
Yeah.
We this will be the first freestanding hospice house in North Dakota.
Wow.
So we're really, really proud of that, and so that is a component of Giving Hearts Day. When you donate on Giving Hearts Day, you can specify if you want it to go to Heather's House specifically, or if you wanted to support general, the general stuff that we are fundraising for every year. So we want people to know that there's an option if you want to support either one. The other thing to mention about Heather's House is because it's in Fargo, we wanted it to be centrally located, but that doesn't mean that it's not going to serve everybody.
Right.
People will be traveling in from other parts of our region to receive that level of care, and we just want to make sure folks know that it's not just for Fargo.
Yeah, that sometimes can be
Yeah.
a little bit of the bubble obstacle to get through when you're reaching out to rural communities and others. It's a welcoming space.
Yeah.
It just has to have a footprint somewhere.
Yeah, and staffing in Fargo is easier than staffing in a tiny town, and it just makes sense for us to have it here. Fargo is where we were founded, and so we're proud to continue the legacy that those 4 ladies started for us 42 years ago. So.
Wow, 42 years ago.
Yeah, we started out with 1 patient, and I've actually had the pleasure of speaking to one of our founders regularly, and she's an amazing, amazing lady. And I asked her, why did you want to start hospice here in Fargo? There weren't any hospice providers, and she said it was a need. I knew about the type of programming, and we just needed to do it. And we've kind of carried that through with hospice in our philosophy of if there's a need, we're going to rise to it, and that's really a driving force for us.
That's awesome. So you hear the need, and then do kind of your research and development and try to fulfill that need.
And that's how we've expanded into the rural areas. Folks will approach us from a small community and say, we need your help. It's like, okay, we always want to start with, how can we do this? And that's really where the community support comes in. It allows us to continue expanding our reach.
Okay, excellent. So, and again, being relatively not used to the services or what y'all do over at hospice, you mentioned we have home care and then building Heather's House. Yeah. Do you all go into hospitals if someone is there, or is that not really? Is it just home care for the most part?
We are in long-term care nursing home facilities as well, and we go in and meet people wherever they are. If they're living, in those care facilities. We actually have folks who we're serving who are unhoused. And so, that creates another layer of challenges. But we nobody gets turned away from Hospice of the Red River Valley. If you need our services, we will meet them. Lack of ability to pay, all of that isn't a consideration. So
That's incredible.
yeah,
Just helping people where they need to be helped.
yep.
That's so awesome.
Yeah.
So with that, Giving Hearts Day, of course, we talked about the capital goal where
Yeah.
we're trying to reach. What other things, if people aren't able to give monetarily right now, how can they support you in other ways?
Yeah. So the biggest way, other than monetarily, is through our volunteer services.
Okay.
And so, we have it on our website. You can go there and kind of check out what we're looking for. Again, those range from licensed massage therapists, helping with some of the pain relief for folks. We have volunteers who go in and will provide a haircut or a beard trim.
Yeah.
I know that is
Personal
you
care.
can't always get out to do those things when you're in that last phase, and
Yeah.
it's about providing dignity, right?
Right.
We are looking for pet therapists.
Oh.
And again, companion volunteers, people who just come in and, maybe they read the paper with the person who's on hospice services. Maybe, they are helping do a puzzle, whatever that may
Yeah.
be. So we have those type of companion services. And then again, administratively, we have a great core of volunteers who are in our office helping us out.
Okay.
And then also we have our thrift store Heirlooms here in Fargo, which is
Oh.
on 25th Street and 32nd Avenue. And we have volunteers who staff that store as well. So
Very cool.
yeah, there's some great stuff in there. So I encourage everybody to check
I
it out.
didn't
if you're in
even
the
know you
area.
had a thrift
Yeah.
store.
Yeah, it's
Excellent.
It's pretty fun. A lot of home goods and really nice home goods that you wouldn't expect at a thrift store. So.
Very cool. So, does that thrift store accept donations?
Yes.
Or
Yeah.
okay, how?
Yeah, so you can drop things off there or give them a call to visit about what it is. We get sometimes with folks passing, we'll get like a china set,
Okay.
or a hutch or furniture,
Yeah.
things like that.
Okay.
And so we love to visit with folks about their items, and we are pretty busy in there a lot of the time.
I believe it.
So yeah, check it out.
It's kind of we're in a little bit of a thrifting era
Yeah.
too. It's very, very popular
Absolutely.
right now. So
Yeah. Upcycle all of the things. So,
yeah, and that's so cool. And maybe, the story that I can tell from start to finish and that kind of real life that you give something
Yeah.
when you
Yeah.
thrift.
Yeah, it really fits in with our mission too, about
Yeah.
paying it forward and the whole process and
Right.
all the things. So
Very cool. I'm going to have to check it out. I've never been there before.
yeah, definitely.
I do love a good thrifting.
Yep.
And then the bears. So that's a specialty kind of volunteer too.
Yeah, yeah.
that
So
give that
if,
service.
if you give us a call. So we have a pattern that folks can follow, and
Okay.
we provide all the materials, so the volunteer doesn't need to worry about any of that. But we always are looking for folks who can sew. I don't know how to sew, and so
we were just having this discussion the other day.
I'm just in such awe of our volunteers who can make those.
The
bears.
talent,
and
yeah.
they're adorable. I should have actually brought one up about that.
I don't know if I've ever seen one of yours, but I have seen that on social
Yeah.
media.
Yeah.
And what an incredible gift.
Yeah, for sure. And then the other way folks can help us too is to follow our social media.
Yeah.
We have Facebook, Instagram, Twitter, the whole gamut. So
Okay.
check us out, Google, or you can search out Hospice of the Red River Valley, and we've got some great content on there from a fundraising perspective, but also from a care perspective. So there might be articles out there that make sense to wherever you might be in your journey as well. So.
All right. Are you ever looking for, we talked about the rural areas, and that always interests me a little bit as I travel the state, where our different locations are and just kind of reaching out to other people. Do you look for volunteers specifically in rural communities, or is it more where you have offices and headquartered, or how does that work?
Our
All
entire service area. We have volunteer coordinators out in Bismarck and
Okay.
DL. So we use you where you're at. And so we just love to talk to folks about what their interests are and how they want to give back. So definitely give us a call, and we will try to meet you where you are.
Okay. And can volunteering with you be a little less scheduled and more based on needs at the current time?
Yeah.
Or is it just kind of dependent on what you can do with your volunteering?
Yeah, it varies. So
Okay.
we've got some folks who are like 2 or 3 day a weekers who go in and they have got their patient load and they're visiting those folks, and it's very regular for them. We've got some folks who are special project volunteers, and so they're just coming in to help with one item or one task. And so it really depends on the volunteers' need or schedule and what they're looking for, and then how it matches up with our needs. But absolutely happy to visit about that with everybody. So.
Yeah, I just always think it's so interesting the amount of different opportunities there are to volunteer. Because I think time is one of the greatest or kind of invaluable assets that we have available to give that we might not be giving.
Right.
And what a couple hours can do for a business or a nonprofit.
Yeah. Yep. And really in the lives of the people being affected by the nonprofit. So what you get out of it and what they get out of it is just like, it's like bubbles up, it's a bigger effect. So
it really does.
Life-changing. So.
It is, yeah. And if you've never volunteered, I highly encourage it. And diversifying your volunteering is always very interesting too. You can get to meet new people, experience different types of joy and passion and what you can do.
Absolutely.
In serving. Awesome. Well, you mentioned online, Facebook, social media.
Yep.
Any other ways we can get in touch if people have questions? What's the best way to reach out?
So our website, hrrv.org. So hrrv.org is a great place. We have a contact us form there. You can also call our 800 number that's listed on that website, and somebody will answer that call, and if it's not clinically related, they'll get it to somebody who can answer that for you.
Okay.
And then socials are a good way to connect as well. We love engagement on those. So we're here for the community, and no question is too small, no question is too early. Just feel free to ask.
I think that's the biggest thing. The door's open. They are there to help and support, whether you're asking for yourself or maybe you have a friend that's expressed something to you and you want to help your friend. They're there, I'm sure, to help connect, be a conduit, get the reach, and just tell the story and help people be comfortable and happy.
Yep.
Awesome. Well, thank you, Kellie.
you.
Anything else we can do or add to it?
Well, we're just so grateful to the community. We wouldn't be able to do what we are without the support of everyone around us. And so thank you all. Thank you, DMF, and thank you for having us on here.
Yeah,
we appreciate
of course.
that.
We're so glad to have you, and we can't wait to see how everything goes and keep us posted on your Giving Hearts Day goals.
I will. It's going to be a fun day.
Awesome.
Great.
Thank you.
Thanks.
Have a good day.